What are the 3 Arora bubbles of data gathering and how can they really help enhance your score? This video is a short video on the 3 bubbles that we talked about in multiple other videos across the channel. Red flags, psychosocial, ICE. If you've been on our online courses or if you've been on our audiobooks or used our live courses or role plays or mocks, you'll know for things like plab 2, RCA, CSA, we talk about these 3 Arora bubbles as part of the first half. So I thought I'd do a really quick video just to cover the concepts about these 3 things and just show you how and why they are so valuable in terms of trying to understand issues in the first half of a consultation. I'm Dr. Arora from Arora Medical Education, and hopefully this video is going to be of some value, whether you're preparing for plab 2 or RCA or CSA or medical school OSCEs or any kind of consultation type exam that needs you to do a data gathering or a first half of a consultation. Now, for those of you who know how we teach, we talk a lot about issues. The first half is all about understanding as many issues as you can. Clinical issues, non-clinical issues, mind issues, life issues, ethical issues. And these 3 bubbles, red flag, psychosocial, ICE, are designed to allow you to understand as many issues as possible and also to reduce the chances of issues coming out in the second half. There's nothing more stressful, as you guys know, as you're doing a management plan and suddenly, oh, by the way, doctor, this comes up, or I thought I should mention this, doctor. Why does that happen? Because usually we have gaps in the 3 Arora bubbles. Now, why do we call them bubbles? Red flags, psychosocial, ICE. Well, first we call them bubbles for 2 reasons. Number one, what do bubbles do? They float. So these bubbles are floating around in the middle of the first half of the consultation, and you can jump into them at any point, okay? We talk on another video about structure and not having a rigid approach, and you do this first, this second, this third. Bubbles float around, so it gives you the freedom to jump into those bubbles when you feel necessary, when the gut feeling tells you, when a cue comes, for example. So they float around. So there's no order for these 3 things, number one. But secondly, they're called bubbles because once you pop a bubble, the bubble is gone. So what we say is when you go into one of these 3 bubbles, it doesn't matter when you go into them, but when you do go in, try and close them down, because if you want to be time efficient, then you don't want to be jumping in and out of these bubbles all the time, because naturally that's going to add a lot of time to your consultation and your first half, and that puts pressure, of course, on the second half. So let's quickly go through these 3 bubbles just to highlight why they are so important. So let's start with red flags first. We've got lots of videos on the channel about red flags in detail, but why are red flags so important? They give you the issues that you cannot afford to miss as a clinician. So you may have, of course, clinical red flags, and we all know those kind of questions to ask, but there are also non-clinical red flags as well. Things like consent, confidentiality, driving in a seizure case. There may be some other non-clinical questions, but in that red flag bubble, you need to demonstrate your ability to rule out 2 things. Number one, the need to do something today, like an admission, or number 2, the need to do something urgent, like an urgent referral, or an urgent blood test, or an urgent test, or an urgent telephone call, or an urgent discussion with the person's consultant. Whatever it might be, you need to rule out those 2 things, whether it's a headache or whether it's eye problems or mood changes or some problem with their back. There are always reasons why you need to do something today or something of an urgent nature. So your red flag bubble is designed to allow you to rule out those things. Psychosocial bubble is designed to look at links. How does something in their life impact their medical problem, or how is their medical problem impacting their life? Now, if you don't talk about this and open up this bubble, then you're going to leave lots of issues behind that will inevitably impact what you do in the second half, okay? So whether it's your home, your work, your smoking, your alcohol, your diet, your caffeine, your stress, your sleep, all these kind of things, driving, drugs, they all come into the psychosocial bubble, and at some point in data gathering, this bubble is important to pick out those issues that, like I said, either are impacting the medicine or things that the medicine are impacting itself. And the third bubble, ICE, is all about issues of the patient's mind. So red flags are telling you issues in a clinical sense, psychosocial bubble is telling you issues in the patient's life, and ICE bubble is telling you issues in the patient's mind. Now, of course, we've got lots of different videos about ICE on the channel, so if you're not used to ideas, concerns, expectations, have a look at some of those videos where we break down ICE in more detail. But if you don't do this bubble in the first half and you start the second half, you are going to have lots of new things thrown at you in the second half. But doctor, isn't it this that's going on? Or I thought it could be this, or I actually worried a bit about this, doctor, or don't you think I need a blood test, or why don't I need a referral? If you don't get those ICE issues, those mind issues out in the first half in that bubble, then you're just going to struggle later on, because new things will come out and surprise you, or they won't come out at all, and you've lost the opportunity to score marks on that part of the management plan. So the 3 Arora bubbles, if you're new to this concept, these are things that you need to do pretty much in every case. Yes, there are going to be a couple of cases where you might miss out a couple, or here or there, acute cases, someone's very unwell, someone's collapsed. Of course, they're different. Medicine takes over. But if you're having a conversation with somebody, these 3 bubbles are important. Remember, don't worry about the order of the bubbles. They float around. You can jump in any order. Number 2, remember when you're in a bubble, try and close it down. And we've talked about how to do that, for example, in ICE and Psychosocial and other videos. And number 3, just make sure before you think about examining, before you think about second half, make sure you double check. You have a barrier, you think 3 bubbles, because you want to realize at that point, oh, I haven't actually done red flags, or oh, I don't know too much about their life, or oh, I haven't actually asked about their mind. It'll give you a reminder to go and do it. Because remember, the first half is all about understanding issues, and issues come from these 3 Arora bubbles. So if you are preparing for plab 2 or RCA or CSA or any type of exam that involves an OSCE, then please try and integrate these 3 bubbles into your data gathering. Of course, you're going to be doing a clinical history. Of course, you're going to be asking your normal things that you do when someone presents with a problem, but make sure these 3 things become a fundamental part of your consultation. And I guarantee you, you'll find that you feel more controlled, and you find that when you start that second half, you feel more comfortable that you've understood the core issues and you've not missed anything major that possibly could change that whole management plan. Now, if you are preparing for plab 2 or RCA or any other exam like this, please do use the coupon Arora Video 10 for 10% off any of our mock exams, live courses, flashcards, online courses, audiobooks. We've got so much on the website that can help you get through those exams. There's so much on this channel as well, so please do subscribe, please do share, please do like, please do comment, and use some of the other material on our YouTube channel and other social media streams as well. We'd love to try and get you through your exams. But remember, 3 Arora bubbles of data gathering: red flags, psychosocial, ICE. I really hope this video has been of some value to you guys. Hopefully your preparation is going well for the exam. Hopefully we can meet you at some point soon. You know the hashtag, Camp ICE will pass. Hashtag I went with Arora. Have a super day.